Here's our agenda for today. We'll start with some introductions. We'll review our request for proposals and timeline. We'll look at the grant information, how to apply, our review process, resources, and we're asking to please save your questions till the very end. So the Rogel Cancer Center and the Office of Community Outreach and Engagement is very, very pleased to share with you. If you don't already know, we've expanded our catchment area to the entire state of Michigan. And I want to introduce the staff of our Community Outreach and Engagement Office. So I think I'll begin with Dana Green.
Hello, I'm Dana Green. I'm a strategic outreach coordinator for our program. I'm happy to see some familiar faces and some folks I don't know. So glad you can join us.
Madeline. Oh, we can't hear you.
My apologies. Hello, everyone. I'm Madeline Gonzalez, health educator with the team. Welcome and good to see you all.
And Katricia Thomas.
Hello, everyone. I'm Patricia Thomas, administrative specialist for our team.
Thank you. And Diana.
Hi, I'm Diana. I'm a program evaluation specialist for the team. Thanks for coming today.
Yes. And we are missing one staff person. Emma Volkert is our public health communications specialist who couldn't join us today. So we'll talk about the purpose of our proposal. While Michigan has seen a steady decline in cancer incidence and mortality, we know that the burden of cancer is not equally shared across the state. There's significant racial and socioeconomic disparities in incidence, mortality, screening, and early detection and survivorship. We also recognize that local community-based organizations are best equipped to meet the unique needs of their respective community. Therefore, we're allocating funding to these organizations via a request for proposals process. I just want to note that this RFP is not intended to fund research, but does fund evidence-based interventions and capacity building activities. Here's our timeline for the 2024 RFP. Note that proposals are due Thursday, January 11th by 5 p.m. Eastern Standard Time, and that notification of awards will be made in early February with a projected start date of April 1st. Projects will be eligible to begin once contract agreements are fully signed by both organizations. Eligible organizations include nonprofits, 501(c)s, community-based and faith-based organizations, federally qualified health centers, federally qualified tribes and tribal organizations, hospitals that are non-federal short-term general acute care facilities located in rural areas of the state, including faith-based hospitals. That in order to be eligible, the organization must also serve a population experiencing cancer health disparities in Michigan. This includes rural, lower socioeconomic status, African American, Native American, Hispanic, Latino, Asian American and Pacific Islanders, Middle Eastern, North African, or LGBTQ+ communities. Ineligible organizations include large hospitals with more than 500 beds, colleges and universities, and state and county governments. There are two funding streams under this request for proposals that includes evidence-based interventions or capacity building projects. Evidence-based intervention projects can apply for up to $50,000. That includes indirect costs over a 2-year project period to implement one or more evidence-based intervention. These interventions can address one or more of the following: prevention, screening, or survivorship across the cancer continuum. A set of recommended evidence-based interventions are provided beginning on page 3 of the request for proposals. Applicants should select one or more from these provided resources. However, these can be tailored to respective populations or subpopulations as needed. We intend to fund up to 3 evidence-based intervention projects. The other opportunity falls under capacity building, where organizations are eligible to apply for up to $5,000 including indirect costs, for a one-year project period. Examples would be establishing or growing a local coalition with formal agreements, procedures and processes and associated activities, which might include something like conducting community listening sessions, which would be used to inform future programming. We intend to fund up to 5 capacity building projects across the state. 2 tables of evidence-based interventions are located on pages 4 and 5 of the request for proposals. The tables were created from the U.S. Preventive Services Task Force Community Guide and from the National Institutes of Health Table of Evidence-Based Interventions. These are broken down into categories for prevention, screening, and survivorship. A third evidence-based intervention is also located on page 5, and this is the Rural Health Clinic Colorectal Cancer Screening Toolkit. And grantees are allowed to tailor these interventions as needed. Under the proposal format, include an executive summary. In this section, you'll introduce your agency, proposed project, title, and population served, and anticipated outcome. Under the needs section, we ask that you describe the specific cancer-related health disparities experienced by the population of focus, include demographic and geographic and relevant health data to describe the need to be addressed by your proposed project. Under the project description, include your selected evidence-based intervention and how it meets the unique needs of the population. Include a detailed work plan with goals, SMART objectives, activities, timelines, and deliverables. You may use a work plan template, which is located as attachment A. And you can find this attachment in the InfoReady platform, which we'll talk about later, and also on our website. Under evaluation and sustainability, we ask you to present your plan to track and measure progress, outline your process and outcome measures and data sources, and discuss any training or technical assistance needs you might have, as well as present long-term plans for project sustainability. Under the capacity section, we'd like you to describe the history of your organization and evidence of past successes with similar projects or strengths of staff and key partners to carry out this work successfully. Under the budget and budget justification, you're to utilize the budget template, also as an attachment, and provide a separate budget narrative that justifies how funds in each line were calculated. It's very similar for capacity building proposals. The executive summary, you'll introduce your agency, proposed project, title, and population served, and anticipated outcomes. The need will provide an overview of the cancer disparities and population of focus, use demographics or relative health data. Under your project description, describe your project goals and SMART objectives with the timeline and benchmark measurements. Describe any key partners and their roles, and you can use the work plan template also found as an attachment. Under capacity, please also again describe the history of your organization, your ability to organize and implement the project, and examples of capacity of the staff. And the budget template can be provided for capacity building grants as well. Just note in your narrative how your totals came to be in your budget. And how to apply. We're going to upload applicants through the InfoReady system. And at this point, I'll turn it back over to Dana and he can describe that for you.
Thank you so much, Noel. So I'm just going to very quickly walk everyone through the InfoReady platform. So InfoReady is a platform that we use here at Michigan Medicine for our internal and external grant process. So I'm just going to walk everybody through it really quickly. Just give me a second to share my screen. All right, can everybody see my screen? Let's see. Oh. Yes, you could. Okay, sorry, everybody. Okay. So, this is InfoReady. The link is umss.infoready4.com. If you visit the Rogel Cancer Center page, and you click on external links for grants, it'll take you to this homepage. When you go down the page, you'll see several different grant links listed here. The grant link that you're going to want to access is Rogel Cancer Center Community Grants to Address Health Disparities. When you click on the link, you'll see a general description and due date. So you'll see the proposal, you'll see the options for evidence-based interventions and capacity building projects, as well as the aforementioned documents that Noel mentioned previously. So executive summary, need, project description, evaluation and sustainability, capacity, budget, and budget justification. And you'll see that twice, one for evidence-based interventions and then one for capacity. So how do you apply? Well, if you're interested in applying, you simply click on the apply button to the right. This grant will not be accessible for University of Michigan employees. So you can completely ignore the University of Michigan web login. You will use a login for other users, which is just slightly below it. For folks who have used this process before, you would simply enter your email address and password that you previously established before. If you haven't used this process before, you would click on the register button here. You'll get this pop-up. Just enter your name, last name, email address, and password. Make sure to hit the I'm not a robot, and you'll have an account generated. You should expect to receive an email from Laura Hassler letting you know that your account has been successfully established. So once you receive that email, you click on the link that's provided in the email to verify. You'll just simply come back to this page and enter in an email address and password. So I'll just quickly demonstrate that. All right. So then you're in. You can begin completing your application. So again, you'll just start filling it out. First name, last name, phone number, primary appointment, et cetera, et cetera. You just follow the workflow here. As far as application details, just enter the title of your proposal. And you could give a brief abstract. And then you would upload the aforementioned files mentioned here. And we ask that everything is included in PDF format so that nothing can be added, or so that there's no mix-ups as far as like edits or accidental changes to your application. And as far as additional documents are concerned, and some of the plans that Noel mentioned before, all of the necessary templates are going to be to your right here. So for example, if I click on proposal timeline, looks like it's black. Okay. You can open up each document and see the document so that it can kind of assist you in your writing. So like even here for the budget template, sorry, computer's moving a little bit slow today. You'll just open it up. Okay, well, in the ideal world, it would open up right away as soon as you clicked on the link. Point is, the budget and or any of these other documents will be available for you review in the application through the links, right? And so once you submit the application, it'll come to our COE team. You'll receive a notification that your application has been received, and then one of our team members will follow up with the appropriate next steps. All right. And with that, Noel, I'll turn it back over to you.
Great, thank you. So a little bit about the review process. Proposals will be evaluated by an internal review committee with expertise on cancer health disparities and specific evidence-based interventions. Proposals will be scored based on the specific criteria detailed in the proposal format section of the RFP. We just want to make note there are some useful resources found within the RFP. This includes a section on rural definitions. If you're not sure if you're serving a rural community or not, there's a link that can tell you based on your zip code. There are other useful health data sources that some of you are probably already familiar with, but if not, they include Michigan Behavior Risk Factor Surveillance Survey reports based on race and ethnicity, and cancer incidence and mortality statistics from the Michigan Department of Health and Human Services. There's also, you can find additional information through your local hospital's community health needs assessment data. Contact your hospital or your county health department for that information. And you can also use clinic or hospital electronic health information systems reports. More information can always be found on our website, and there's contact information if you're having trouble or you need additional information from us. And with that, we could turn it to questions. I'll ask you to please raise your hand, and we'll call on you in order.
We must have done an incredible job explaining it for our first time. Way to go, us.
Yes, yes. Well, if there aren't any questions, again, we thank you for your interest and your attendance today. Please reach out to us if you have any questions in the future, and we look forward to hearing from you all. Thank you.
Thank you.
Thank you. Have a great day.